Dr. Planty, some people have, and I don't think I ever did yet, but they have dry eyes, irritated eyes, and you see television ads for that stuff. So is that thing just something which is irritating, or does it also have health effects? And regardless of what it is there actually something which can be fixed? Is the over-the-counter stuff fine? Shed some light on it. Tell us a little bit about it.
Well, dry eyes is probably a leading cause of irritation for thousands and thousands of patients. And there's a number of different reasons for it. If you've had surgery on the eye, you're going to go ahead and interrupt the tear flow at that particular point. As you get older, you produce less tears. The big thing about tears and what's creating the biggest issue is in the cornea, which is the anterior surface of the eye, needs to be crystal clear in order for you to see. And there's no blood vessels in there, so the only way that they can get nourishment and stay healthy is through the proteins and all the nourishment that's in the tears. So if there's something that kind of interrupts the flow of the tears for whatever reason, whether it's old age, whether it's surgery, whether it's injury, whether it's just a breakdown in the system for one reason or another, it's going to affect the quality of your vision at that particular point. Initially what we do is we try over-the-counter stuff because that's the least expensive route at that particular point. In probably 50 to 60% of the cases, the over-the-counter stuff is going to work well. Some products are going to be better than others. I have my own personal preferences on a number of different products. But if you listen to the commercials about getting the red out, if you've got red in your eye, the red is because it's trying to fight off some type of allergy or infection. You don't want to just get rid of the red. You want to figure out what's causing the red, get rid of that, and then you won't have to worry about the red and irritated eyes. So dry eyes is a really big problem in a lot of different areas for a lot of different people. And it is something that can be treated. There is no cure for it. You're going to deal with it for the rest of your life. So it's something that you just got to learn to take care of as opposed to cure at that particular point.
But the taking care of is kind of like eliminating the red in the first place. So the taking care of is not just putting some liquids in it and oil it. It is actually something before, except you have to do that all the time also.
Exactly. It's never going to go away. Your eyes are always going to be irritated because of the dryness to the cornea. Because once you start drying out the cornea, you start exposing nerve endings that are very, very painful. That's where you get that dirty, sandy, gritty feeling because the ocular surface is not smooth like it should be because the tears are missing in certain spots. It's very aggravating at times, and it will interfere with the quality of your vision. That's where you start to see is it a 3 or an 8? Is it a or a 4? You start missing words in the sentence just because of the surface is not smooth and uniform because the tears or the quality of the tears are not where they need to be. And again, we start with over-the-counter stuff to see if we can kind of coat the eye and eliminate some of the issues. But there are some advanced treatments that you can get with prescription medicines, and there's even some surgeries that you could do to try to fix the problem, so to speak, as far as the tear ducts go and things like that.
I have a real good solution. It works for me at least. Just go and see a movie, any love story, a good one, a not so good one, even a fighting movie. I'm not kidding, I can't walk out of a movie rarely, why not once or twice throughout the movie I cry. Just the smallest little thing, the puppy dog getting saved. It wouldn't matter what it is. I cry. So is that
chick flicks are where they at, baby.
Yeah.
Chick flicks are where they at.
Yeah, so
keep the wife happy, keep the girlfriend happy too.
It's a good thing that tears are coming out for a health reason at least.
No, absolutely. I mean, and there are some people that can't cry because the gland that produces tears is damaged at that particular point. And there's a number of the systemic diseases that will interfere with the lacrimal gland, which produces the tears. and you get into that stage, and again, basically you're wearing a bandage contact lens as a moisturizer for the cornea at that particular point. So there's some devastating diseases out there that can interfere with the eyes, but in the majority of the cases, they can be treated with just ocular lubricants or some type of medicine that will go ahead and improve the quality of the tears.
It's amazing how the body has, things built in that they actually, there's a reason for them, just like the tears. And if you talk to a dentist, people with heavy saliva, even though it might have a couple of slightly unpleasant side effects, you spit a little easier, you build up more plaque on your teeth, but basically it just simply means you're very healthy. As a basic.
Oh, sure.
And so same thing is what you're telling me with the eyes. The tears are a needed effect. They're supposed to be.
Oh, absolutely.
Wonderful.
The tears are very vital to the health of the cornea.
Okay, good. Well, very informative again. Thanks a lot, Dr. Planty.
All right.